In the country, there is a growing concern about the large number of youth and men who are at risk of infection. And with these, men have been accused of fearing to get tested. Cornwall Fire visited some counties to assess the situation and prepared the following report.
New figures from the National Council for Disease Control show that more than 1.38 million Kenyans are infected with the HIV virus. Although men account for only 25% of infections, they represent nearly half, that is 48% of all AIDS-related deaths in 2023. HIV infections are still highest in the counties of Homa Bay, Siaya, Kisumu, Migori, and Nairobi, where 51% of new infections are reported, as explained by the regional manager of Nyanza AIDS Healthcare Foundation, Dr. Oliver Mito.
Men are heavily involved in teenagers getting pregnant and even the new HIV infections among our young girls. So if we can manage to bring our men on board, we'll ensure that these kind of issues don't happen. And that is why there's so much focus on the men.
It is in Homa Bay County in East Kabondo Ward that we meet Wesonga Valerie, a widow whose husband died due to HIV infection. She says her husband never preferred to go to the hospital for treatment.
Ukipatikana ama unajishuku kuna ugonjwa, tafadhali mwende hospitali na partner wako mwende mpimwe. Mimi bwanangu angesikia maneno aenda apimwe. Saizi tungekuwa tuna meza dawa, tungeendelea na maisha yetu na tungelinda familia yetu. Ameniacha sasa, mimi ndio nalinda watoto peke yangu.
Valerie, who is blessed with 3 children who are not infected with the virus, encourages men to embrace treatment if they are found to be infected with HIV virus.
Nijaribu msikie wapendwa wenu, mwende hospitali mjipime, mkue pamoja mlinde watoto.
Elsewhere in Rachonyo sub-county, we meet an elder, Joseph Odur, who tells us just why many husbands or men do not get tested to know their health status.
As per my opinion, men feel they are the bosses, and sometimes they still think HIV belongs to others, not themselves. The challenge is, so into the community, we still just preach the word HIV has no border, it's no boundary. Anybody can have it. So the best thing is to just come out and be tested, irrespective of your status in the community.
Young people also explain the reason for not showing up to receive drugs to reduce intensity of the HIV virus when they are infected.
Damingi ambayo vijana wengi siku hizi hawataki kuchukua dawa. Wanajionanga hao ni bingwa yani. All time wanajionanga tu yani wao wametosha. First kama kuna demo, utaki kuelezea demo ati unachukua medication. Itabidi ndio prove your girlfriend wrong ati you are not taking medication. You have to follow your girl's rule.
Unlike women who often come into contact with health systems, especially during pregnancy, men rarely seek treatment until the condition is severe. This leads to late diagnosis and poor outcomes. Similarly, the use of antiretrovirus drugs, ARV, among men has increased from 81% in 2020 to 90% in 2023, still below the UN AIDS target of 95%.
According to the HIV 2023 estimates, we found that 70% of the deaths came from men aged 30 years and above. So this clearly shows you that our men are not doing well health-wise in terms of, if you look at people who are infected with HIV and their outcomes, we are having our men having poor outcomes, and that's why most of the deaths that we're having from HIV-related are among our men. We are having our men and young boys shying away from coming to the facilities. Most men and young boys don't like to come to the facilities and queue. So we have a large pool of men and young boys who have not been tested for HIV outside the community, at the community level. So these are the ones who are spreading unknowingly.
Challenges such as drug use, stigma, and non-participation in preventive health programs contributes to these problems. The data also shows that adolescents and adults aged 15 to 34 years accounted for 73% of new adult infections in 2023.
They involve themselves in issues that actually detrimental to their health. We have issues to do with dangerous sexual behaviors, and these actually have overall effect on increasing their risk of getting HIV and AIDS. AIDS. So if we manage to talk to our men and boys well, if we manage to control our men and boys well, at the end of the day we'll be able to arrest the HIV spread and even eliminate AIDS by 2030.
Experts say there is need for special measures to deal with these challenges. The clarion call to Kenyans continues to be responsibility in putting their efforts to contribute greatly in reducing the spread of the HIV virus.
And because of poverty scale, you offer a woman big amount of money, she will give in. And you know, sometimes to these other people, they'll talk of condom use. But for a dozy who gives out big cash, they will go in without using protection. In fact, it is a challenge, but it is a message that should go out and reach everybody. I have empathy for them, but I hope men one time will change. Each person should get tested.
So what we really want is the men and young boys to come out strongly, pick this issue up, come to the facilities, get tested, know your status, and if positive, be on medication, because we've been propagating all along is undetectable is equals untransmittable.